Most parents become upset when their children are bedwetting. They lose their temper, they scold, and sometimes they give physical punishment to their children. Bismillahirrahmanirrahim. Assalamu alaikum viewers, Dr. Zafeer with you, and you are watching my informative vlog on Facebook and YouTube channel. Parents should know that bedwetting is absolutely involuntary act and the child is not aware. Nocturnal Enuresis, defined as nighttime bedwetting after age 5. It affects many school children and even some teens. It's more common in boys than girls. Girls usually obtain bladder control before boys do. Primary nocturnal enuresis, that means nighttime bedwetting, where the child was never dry. It is called primary enuresis. It has a high rate of spontaneous resolution. Bedwetting is not a serious health problem and children usually outgrow it. Your child is not the only one who is bedwetting. 15% children are bedwetting at the age of 5 years. 5% children are bedwetting at the age of 10 years. 1 to 2% children are bedwetting at the age of 15 years. There are two types of nocturnal enuresis. Number one is primary enuresis, where the child was never dry. And the secondary enuresis in older children or teens, in which bedwetting started after having a period of dry. Secondary enuresis should be evaluated by a doctor because most of the times there are some underlying pathology. Bedwetting in this age group could be a sign of urinary tract infection or other health problems, neurological issues, stress, physical or sexual abuse. The cause of enuresis in a child is anxiety, attention deficit hyperactivity disorder, constipation that puts pressure on the bladder, delayed bladder development, diabetes, urinary tract infection, not enough antidiuretic hormone in the body during sleep, obstructive sleep apnea, emotional stresses at home such as parental conflict, or at school, bullying, trauma, hospitalization, moving to a new home, enrolling in a new school, the death of a loved one, or sexual abuse can be a trigger for children or teenagers to start wetting the bed, even when they have been dry for months or years. Bedwetting can be inherited. The bedwetting gene is strong among families. Half of all children who have this problem had a parent who also struggled with bedwetting. This percentage goes to 75% if both parents had enuresis. On this information, you must be smiling. Children with enuresis are often described as heavy sleepers who fail to awaken to pass urine when their bladder is full. If your child wets the bed frequently, they may experience bullying or teasing from family members, siblings, or peers. This can impact their emotional and social development by causing shame, embarrassment, and fear of participating in sleepovers, family holidays, and certain school activities. 20 to 30% of children suffering from nocturnal enuresis and urinary incontinence also have special needs such as attention deficit hyperactivity disorder or autism. If you are a parent of autistic child, You should be aware of the link of bedwetting and autism. You should seek support if your child is experiencing bedwetting beyond the age of 5. So, what to do to help your child with nocturnal enuresis? Let's have some plan. Number 1, limit fluids 2 hours before bedtime. Number 2, make sure your child goes to the bathroom right before he goes to bed. Number 3, avoid caffeine. Number 4, never punish your child for wetting the bed. Number 5, after a certain age, medicine can be sometimes prescribed. Now, how a parents can help a child who wets the bed? Number 1, manage daytime fluid intake and urination. Focus on what is going on during the day. Number 2, minimize disruption and discomfort at night. Number 3, consider a bedwetting alarm. Talk with your child's primary care provider about medication. Behavior therapy with a urine alarm is the treatment of choice for simple bedwetting. In the management of bedwetting, I also prefer to introduce star charts and reward system for a dry night with a positive encouragement. Dear parents, in the management of bedwetting, I found the simple strategy of rewards chart for dry night quite effective. You can try this with consistency of the reward system. There are some foods can be avoided in bedwetting child, like excessive salt, chocolate or coca, carbonated drinks, tea or coffee, fruit juice. As you know that chocolate, coca, tea, coffee and some carbonated drinks contain caffeine, which is commonly known to have a diuretic effect. Caffeine also increases pressure and excitability on muscles that control the bladder. Foods that are high in folate, fiber, vitamin B12 and omega-3 fatty acids are all recommended to help control or reduce bedwetting. No medicine has been proved to cure bedwetting permanently, and the problem usually returns when the medicine is stopped. So, the take-home message for parents: Number 1, night bedwetting is common in children. Number 2, more common in boys. It's familial. Number 3, it's involuntary and the child is not aware. Number 4, avoid physical punishment. Number 5, keep eye on his day-to-day behavior, school performance, bullying, anxiety, stress, etc. Number 6, after months or years of dry night, if he starts bedwetting, consult your pediatrician. Number 7, use waterproof mattress protectors. Number 8, reduce evening and nighttime fluid intake. Number 9, initially manage for 6 months with a start chart, reward for dry night and give a positive encouragement. Number 10, encourage your child to take part in managing the issue, like changing their own sheets or setting an alarm to wake up for bathroom trips. Number 11, consider medical treatment if the above management does not work. Number 12, remember, most of the time bedwetting stops spontaneously by itself. So it's not a big problem. Stay blessed. Thanks for watching my informative vlog on Facebook and YouTube channel. If you like this video, please subscribe and share.